Hi everyone, my name is Jocelyn Conley. I'm a pelvic floor physical therapist at Moment of Truth Physical Therapy. And in this video, I'm going to show you how to test yourself to see if you have Diastasis Recti abdominis. Diastasis Recti abdominis is when the abdominals are separate due to stretching or weakness in the connective tissue called the linea alba. It is common. It's common in postpartum women, and it's also something that is normal during third trimester of pregnancy. Now, even though it's common after in the postpartum period, it is not a normal thing that you have to live with. Common signs or symptoms of diastasis recti include back pain or issues with regulating pressures, so it can lead to things like urinary leakage and heaviness either in your abdomen or pelvis. So two different ways. First way is going to be in a lying down position on your back. You're going to lie on your back and you're going to take your hand. Now I would recommend using a pillow. I just don't have one right now. You're going to take your fingers, squeeze them together, and find your navel or your belly button. You're going to sink your fingers straight into your navel. Now as you sink in, just take an inventory of how much resistance there is. So you may need to get through any fat tissue first and really sink, and you should feel your tissue pressing back at you versus feeling like you can reach all the way down to your spine. So once you feel like you've reached that point where there's resistance and it's pushing back, you're going to lift your head and your shoulders up like this, and then you're going to control back down. As you lift up, what you are paying attention to is closure of your abdominals around your fingers. And if there isn't closure, you're taking note of how many fingers or how much distance there is between that tissue. Anywhere from a finger to a finger and a half is what's considered normal. Now the second thing to pay attention to is as you lift, does the tissue below press out? Like, does it kind of push you out? If you feel like you can keep sinking and there's not a lot of tissue pushing back or pushing you out, then we care about that as well. We care about the depth, not just the width. So after you test here, you're going to go about two centimeters below and do the same thing. And then you're going to go 2 centimeters above and do the same thing. You can pick a few different spots if you notice that there is a gap or there is a lot of depth in any of those spots. If you do find that you get a positive test, meaning you do have DR and it's more than a couple fingers, then we recommend that you come in. We recommend that you come in anyways if you suspect DR, but we recommend that you get checked by a professional. That way we can make sure you're on a program that is helping strengthen this tissue versus the opposite. Because there is, if you do certain exercises in a certain way, it could make it worse. The second way is in a standing position, and this is just a quick screen. There's other ways to do it, but this is one of the easier ways. And what you're looking at, and I wish I could show you my skin, but I can't, is you're looking at if you see spinal motion when you balance on one leg. So because you can't see my skin, just pay attention to my clothes. I'm going to stand on one leg, and what you shouldn't see is movement in my pelvis that affects my spine. And then you would go on the other side. If you are doing this on yourself, it's really helpful to have someone to take a video or to watch and see if there's any twisting or movement of your lower back. Now that test really checks for the loss of stability at different levels in your ribs and your pelvis. It does a really good job at capturing everything, but it doesn't get all of the things. So it's really helpful to actually be checked by a trained provider. So in this video, we covered just the basics on Diastasis Recti abdominis, and I showed you 2 ways that you can screen yourself, which is helpful to guide your training after you've had a baby or after you've had an abdominal procedure. And then it's also helpful to help you see that it's important that you see a professional like pelvic and abdominal health physical therapist. My name is Jocelyn Conley. I am a pelvic floor physical therapist at Moment of Truth Physical Therapy. I hope this was helpful. If you have any questions, post them in the comments below. Be sure you like this video if it was helpful. Share it with a friend if you know someone could benefit from this information. And don't forget to subscribe so you're notified every time we drop a new video.